Your child is scheduled to have an MRI with sedation or anesthesia at Children's Hospital Boston. This slideshow is designed to show you what it may be like when you come to the radiology department in Boston or one of our satellite locations. MRI uses a large magnet, radio waves, and a computer to produce 2- and 3-dimensional images of the body's organs, tissues, and bones. It does not use X-rays. MRI pictures are reviewed by a doctor called a radiologist. Movement will cause the MRI pictures to be blurry. Most children under the age of 6 are unable to hold still for the length of time required to complete the scan. The use of sedation medication or anesthesia will help your child go to sleep and remain motionless and comfortable. An assessment nurse will call you to schedule your child's MRI. She will give you instructions that will include dietary restrictions. It is very important that you follow them, or the scan may need to be rescheduled to another time. It is helpful to give your child a simple explanation as to why an MRI is needed. You may want to bring his favorite book, toy, or comfort object for waiting times. When you make your appointment, the scheduler will tell you when to come to the hospital. When you arrive, please go to the MRI radiology check-in desk in the main building on the 2nd floor, or the 1st floor check-in desk at our Waltham facility. An ambulatory service representative will check in your child and verify his registration information. She will give you a safety screening questionnaire to fill out for your child. If you plan to accompany him into the scanner room, you must also fill out a form for yourself. This form will make sure that you and your child do not have any items on or within the body that will be affected by or move in the presence of the magnetic field. Your child can color or play with the toys and books available in our MRI waiting area while you complete these forms. When your paperwork is complete, an MRI team member will take you and your child to the exam room. Before that, he will be weighed and measured. In the exam room, your child will change into hospital pajamas and remove barrettes, hairpins, and jewelry. You will both need to remove all metal objects, and lockers are available to secure any valuables. Once your child is changed, we will confirm that all of the advanced instructions were followed. We'll review his health history, current health status, and medications. We will also check your child's temperature, heart rate, breathing rate, blood pressure, and oxygen level, and listen to the lungs. It is important to notify us of any active or recent illness, allergy, or previous drug reaction. You are encouraged to ask questions throughout the process. After the physical exam, we will place an IV in your child. Numbing cream may be applied to the skin to lessen the discomfort. You can help your child by providing comfort and reassurance. Once sedation or anesthesia has been administered and your child is asleep, the MRI technologist will position him on the scanning bed and fasten a belt to make sure that he is secure. The technologist will also adjust the radio frequency coil around the body part to be examined. That area of the body must be in the center of the scanner, so the technologist will move the bed into the tunnel until it is appropriately positioned. Once your child is positioned, the scan can begin. The technologist will acquire the necessary images as the sedation or anesthesia team monitors him. MRI scans consist of several sequences of a few minutes duration each that cumulatively take anywhere from 20 to 90 minutes, depending on the information required by the radiologist and your physician. We will give you a more specific time frame before the scan begins. When the MRI is done, your child will be taken to the recovery room to be monitored until discharge. The recovery room nurse will give him fluids through the IV. Once awake, your child may be given some juice or crackers. When it's time to go home, the nurse will remove the IV and monitoring equipment. You will be given discharge instructions with contact information in case you have any questions or problems after leaving the hospital. The nurse will call the next morning to make sure that your child has fully recovered from the sedation or anesthesia. A wheelchair with a safety strap will be used to transport him to the car. You are strongly advised not to take public transportation after your child has had sedation or anesthesia. Once you're home, your child may still be sleepy, so it is important to guard against falls. The radiologist will review the images and create a report of the findings and diagnosis for the referring doctor. This report will be sent to your child's physician, who will then discuss the results with you. We hope this presentation has been helpful as you prepare for your trip to the hospital. If you would like more information, please consult our web pages or give us a call. We're always willing to help.